we're gonna give 2 aliquots, or in theory, 2 doses. One dose is going to go to the left lung, the other dose is going to go to the right lung. So even though I have 3 mLs total in here, what I'm gonna do is actually transfer half of the dose of what's prescribed to the patient. So if this is my 1 kilo patient, it's still 2.5 mLs. So half of 2.5 is 1.25. So what I'm gonna do is I'm gonna transfer it to a second syringe. So we're gonna have 1.25 in one syringe and 1.25 in the second syringe, okay? So now what we wanna do is have an extra air bolus after the fact, because we wanna be able to give the patient the entire dose of surfactant, and some may be kept in the catheter. So we just wanna give them, set them up for success, give them about another half ml of air or 1 ml of air. So we did that here. So I have my 2 aliquots, or my 2 doses. I have my patient that is intubated. I have my meconium, my MAC catheter or my surfactant catheter available. The difference between this and a regular suction, of course, is the lure lock versus the emergency stopper of the suction. So we are going to pretend to dose this child here with my 2 vials, or my 2 aliquots of my CuroSurf. Okay, so we are bagging the infant, making sure that our saturations are appropriate, making sure that our heart rate is appropriate. We're setting them up for success. And now I'm going to go ahead and attach my first syringe, make sure it's lure locked appropriately. And now I'm going to give my first dose. So I'm going to advance, just like I would advance suction. I'm going to match my numbers up to my numbers on my tube. So I'm looking for 15, and I'm gonna match 15. There, that's the appropriate distance. So now I'm going to rapidly give the surfactant with my air bolus behind it already set. Give it rapidly. Remember to remove the catheter, continue bagging, and turn my baby midline, making sure that my head is in the same direction of my body. You do not want to just turn the head or just turn the body. You want to do them together. So we're going to bag that first dose in until it's completely absorbed. If you see any kind of regurgitation of the surfactant, you may want to give a little bit of a longer eye time to help distribute that into, in theory, that left lung first. So we're gonna wait until you no longer either hear the rhonchi with your stethoscope, or until you no longer see any of the surfactant coming up and out of the tube. So after a couple of minutes, we feel like it's been absorbed. We're going to move them back supine. And now I'm going to attach my second aliquot, or my second dose here. And we're gonna do the exact same steps, but now we're gonna turn to the right. So again, surfactant's here with my air bolus. Going to advance the catheter in, matching them up again, 15 to 15. Provide my bolus. Remember to pull my catheter out and then turn head and body together. So we're gonna wait until that's absorbed as well. No regurgitation in the tube. Listen to breath sounds, make sure it's all absorbed in the lungs. Make sure our baby's stable. Look at the saturations, look at the heart rate. And then after everything's been absorbed, we're going to put them back supine. Now, suction, we should try to not suction for at least 1 to 2 hours per manufacturer recommendations. But in an emergency, if you feel that the patient is deteriorating and the tube may be clogged, of course, suction if needed. A good tip is I usually actually leave this in and put a red cap on here just to try to remind other staff members that we shouldn't be suctioning for at least the next hour or two. But once that hour or two has passed, now we're going to change this catheter for safety reasons, because we don't want to just hook up suction tubing here. So we're going to change this catheter to an actual suction catheter.